All right, so we are in week 4, which is exciting. It's getting there. All right, so I'm just pulling up week 4, the journal, make sure I hit all my points. All right, so describe a new experience, significant event, patient interaction, never seen before, diagnoses, etc., that you have experienced in clinical this week. I don't really have like a significant event patient interaction. Okay, so during clinical, it's telehealth, and there was she is 13 years old, and she was being seen for med management. She is MDD with psychosis features and has hallucinations, sees things that are not there, mainly shadows, and hears voices with no commands, just random voices. So she's on risperidone, 1 milligram. She is on Zyprexa 5, the Zydus, the ODT, and that was to be given when there were features of psychosis by mom. She's on Visceral, 25 milligrams, the PAM to help with anxiety. She is also on clonidine for anxiety. And so she was doing well. She had a hospital. She's had 3 hospital admissions for SI, actual attempts. So the first one was she attempted to hang herself. The second one, she tried to OD with meds. And then the third one, she slit her wrist. So when we called her, they were eating at McDonald's. So she was asked to be in an area where we can disclose personal information. They went to the car, just like I thought it was a easy peasy visit, but in asking questions, mom was like, yeah, I was waiting for you to call to see if I should take her to the hospital or not, because she's been saying she wants to kill herself again. And our hearts drop, okay, well, it was like, well, what's the plan? And it's not for this clinical rotation, it's for my therapy rotation. But it's an experience I'd still want to express. Anyhow, my preceptor was like, okay, so does she have a plan? Well, she wants to use the pills again. And she asked to talk to the child, and the child just looked like blunted. And okay, how are you feeling? How are you doing? Fine. Real short. Are you having thoughts of hurting yourself? I've been telling her that I'm going to do it. I've been showing you guys that I can, and I'm going to be successful. So, obviously she was referred to the emergency room. We did a follow-up call to make sure that mom did transport her, and she did. The preceptor was very adamant with mom that you don't need permission from your therapist to go to the hospital when your child wants to end their life. But mom did say, well, I've been with her all day. She slept with me. I haven't left her alone. And so I just wanted to make sure this wasn't one of those times where I'm just needing attention, because she's done this before. So a lot of education and support with mom. Anyhow, the preceptor did call the emergency department and gave her, to the attending, her her background, and her information, if any, updates were needed. But yeah, it was interesting to see it over the phone. You feel like, when you're in a clinic or a facility, you're there. You can see them, you can keep them from hurting themselves, you can, do what you need to do. But over the phone, it was like you feel helpless. And then they're on the East Coast, and I'm just like, that night, I'm sitting there and I'm like, I wonder what happened. I wonder if, they admitted her. I wonder if it was one of those, when you hear, oh, this is like the fourth time and they just discharge her, and then what if she really is successful? And we followed up, and she was transferred to a level 1 psych hospital. So we'll be seeing what that discharge plan is going to be. But seeing it from telehealth versus being with them is a whole other world. I felt very anxious, to be honest with you. And then, so the other thing I learned too is like, well, I thought, well, you're going to call 911 or a crisis response, or, well, if you call 911 and you're in a different state, you're teleworking, guess what? The 911 operator is going to answer in your state, and you're calling for New York. So they actually have a process where my preceptor works, is that the office that is in that state gets, they communicate like through a Teams kind of portal, and they call the crisis response center because it's local. So that I didn't know, was new to learn. Okay, so discuss the impact this had on you in terms of increasing your understanding. Telemed is not easy. Maybe because I'm just so used to being like in person and seeing like the demeanor, and seeing, I can see them in person, how they're reacting, versus a conversation where, it started with, oh, we're at McDonald's, just chilling, having a good time. By the way, she's been wanting to kill herself. Like, wait, what? Explore your personal strengths and limitations that affect the provider-patient relationship. So in this part, I felt like, okay, we know what to do. We need to make sure that somebody is keeping an eye on her, that we refer to the emergency room, that we do follow-up. So that was kind of nice. Like, okay, I know what I'm doing. And as far as like the provider-patient relationship, it was a lot of really having that open communication with mom. And reflect your special learning insight. So I learned that, you're in a different state, you call 911, it's not going to be in the state that they're at. So there's got to be a protocol if I ever do telehealth, on how do I get help for the residents that I'm taking care of, be proactive, especially with a situation like that. Identify some things specific that you learned from reflecting on this event or interaction, and tell how you will apply that learning in your future practice. Conversation can go from 0 to 100. And yeah, telehealth is a different world. And how's that going to be in the future? A lot of things I'm taking note to be prepared if I decide to do this, going forward. But yeah, week 4.